first video, we talked about we defined fertility, and we try to classify them into primary and secondary. Now, this second video, we want to talk about the difference between infertility and subfertility. We defined what infertility is all about. But most times, some people are suffering from subfertility, not infertility. So people use the two words, interchangeably, and that is what we want to resolve before we go into the causes and how to manage them. First, we look at subfertility. Subfertility, in its simplest definition, is a reduction in reproductive capacity from a normal level. So if there is decreased efficiency of your reproductive capacity, then that is subfertility. Then another difference between the subfertility and infertility is that most times with time, subfertility, you can still conceive. But in infertility, most times you must seek medical attention or there must be medical intervention for you to more or less for you to conceive. So now, there are many things. So I want people to be careful about the use of this, because naturally, for each menstrual cycle, we as human beings, we have 18 to 20%, chances of conceiving. That means if a woman has all the things, all her reproductive organs, hormones, everything is okay, and the man is also okay, and they're having regular uninterrupted sex, so they have 18 to 20% chances of conceiving. So that means naturally we human beings seem to be infertile, because that's if I can bring that ratio or that statistics to a layman's understanding, it means that if there are 100 women that have their normal hormones, reproductive system, everything is okay, and their male counterparts are okay. So for each menstrual cycle, out of 100 women of that category, that 18 to 20 will conceive. So what happens to the remaining the remaining people? You understand? 78 to 80 people. What happened to them? So that means even with your intact reproductive system, with your man functioning well, you having regular intercourse, menstrual cycle, you see that about 78 to 80 people will be left out. They will not conceive. So that is why this differentiation is important, because some people will say they are suffering from infertility because they are unable or unable to reproduce within 12 months of regular, uninterrupted, and unprotected sex between two opposite sex. So subfertility, just like I say, is a reduction in reproductive capacity from normal level. You understand? There are many things that can cause that subfertility. Age is an important factor there. And we talk about lifestyle changes. Lifestyle changes stress can also cause it, as we are going to go into causes of all these things. Most times the causes seem to be almost the same, but you've understood. So the only difference between this subfertility and infertility is that with time, subfertility, there will still be conception without medical intervention. This is important because some people have gone to hospitals, they've run all the tests, they say they are normal. So you just have to look at the age. Is important. There is still intact reproductive system and hormones, but just that they are reduced from normal. We are going to be meeting them as we proceed in the courses. Then, just like I said for each menstrual cycle, we have about 18 to 20% chances of conception. You understand? So you now ask, what happened to the remaining 78 to 80 chances? And I try to bring it down to a layman's understanding. That means if there are 100 women, with intact reproductive system and hormones, everything is okay, and their male counterparts are also okay. So about 18 to 20 will, of course, get pregnant, while the remaining 78 to 80 will not get pregnant. But that is one way. Now, also, you need to understand there is a cumulative increase in pregnancy rates as couple continue to have their own uninterrupted sex. That like we have observed, or there are statistics that within 6 months of continuous sex, then about let's say 70% of couple will conceive. You understand? Then after 12 months, about 80% will conceive, and after 24 months, that is 2 years now, you find out that 90% will conceive. So by now, I think my audience can understand the difference between infertility and subfertility. In infertility, there must be medical intervention. So that means when you run all the necessary tests prescribed by the doctor, not by chemists out there, or not by a pharmacist, this work must be done by a doctor, precisely a gynecologist, and so on and so forth. Then, in absence of gynecology, a medical doctor can also knows what to do there, and he knows when to refer when it is beyond him. So remember, the essence of this video is to enlighten the public. Thank you. Watch out for the next video, where we are going to talk about, we start taking the courses one after the other. Thank you. Remember to like, comment, subscribe, and share for others to learn, so that people won't be going to religious houses for things like this. These are purely medical, matters. Thank you. See you in the next video. Okay.